Hello everyone, I'm Neelofar. I'm one of the doctors working at Queen Alexandra Hospital, Portsmouth Hospital NHS Trust. I'm presenting a poster on behalf of my team about an audit we conducted with me and my team under the supervision of Dr. Yahia, who is a clinical director of Department of General Internal Medicine at QA Hospital. So the title of our audit is Evaluation of Frailty Assessment Management Practices in patients under 85 years of age in GIM Wards at QA Hospital. We conducted this audit, a two-cycle audit, because frailty significantly affects patient outcomes such as hospital readmissions, morbidity and mortality in elderly patients. At QA Hospital, patients under 85 years of age are admitted under the care of General Internal Medicine ward. So they do lack regular inpatient frailty related services. So we conducted a two-cycle audit to assess frailty assessment practices, management practices, and its effect on patient outcomes such as hospital readmissions and advanced care planning. So methodology we used was retrospective data collection. Eligible patients were all inpatients admitted to GIM wards over a period of 5 days. First cycle was conducted in January 2024 and second was conducted in August 2024. We evaluated patients mainly for who was assessed for CFS, clinical frailty score using the Rockwood scale, who had a comprehensive geriatric assessment done by a doctor on ward, such as documentation of CFS or just a general CGA done on admission. And we also evaluated how many prevalence of frailty, that is the percentage of patients with CFS more than 5, CFS 5 and above. We also had a look of correlation to comorbidities such as dementia. We also had a look at number of patients with frailty who had an advanced care planning done or not, and we evaluated patient outcomes such as hospital readmissions related to frailty as well. In between the two cycles, we implemented some changes such as staff education. We created ward posters, and we also implemented a frailty multidisciplinary team meetings in the GIM department. So the results of the audit showed some significant improvement in frailty assessment and management practices, such as compliance with frailty assessment increased on admission increased from 76% in the first cycle to 94% on second cycle. Frailty detection, that is, we were screening more patients for frailty, like there was a prevalence of frailty increase, but that also suggested that we were screening more people with frailty. It increased from 36% to 75%. CGA assessment or documentation of CFS score increased to up to 35%. However, advanced care planning for frail patients remained low at 3.03%, so it still suggests we need to improve more on this aspect. Yeah, so the conclusion is that there are significant changes in the assessment and management practices, but we still need to work on some aspects. Recommendations being, we might have to conduct further audits to continuously assess frailty. Think of maybe triaging patients based on frailty rather than age, conducting regular frailty MDTs, and encouraging staff to participate in that. Educating staff to conduct CGAs and referral to frailty intervention teams as well. Also, implementation of a straightforward pathway for documentation of ACP is one of the important recommendations. Thank you.